Hi, welcome to the next Torsion Explainer for Children. We've got here a toolbox of resources available to improve outcomes for children with torsion. I've done a huge amount of work with my MD and postgraduate studies to understand why young people come late to hospital with torsion. And while process is quite a lot of it, one of the big things is knowledge. So we've made this amazing website where young people are able to find out about torsion, but we've also designed a lesson that can go into schools that can be accessed through this QR code. So have an explore and see how you might be able to help people in your region understand more about torsion. So the next step to improving outcomes is to really understand why children need to be transferred. And so what we thought is we'd try to understand what the workforce issues were. So actually, is this a matter of not being able to get into theatre, or is this a matter of confidence and decision making? And what we found really interesting is that talking to paediatric surgeons, emergency specialists, general surgeons and neurologists throughout our region showed that actually confidence was really poor. Only 50% of people were confident in assessing and examining children with an acute scrotum. 37% were confident in decision making, and 34% they'd had no training at all. And guess who were the most confident? Those emergency specialists, of course. Then the paediatric surgeons, and following in as the least confidence actually was the urologists. And what about the training issues? So a lot of what we're trying to ask people to do is for people not so confident to look after children, and often it's the general surgeons that we're asking rather than the urology team. And as you can see, that the experience of general surgeons in their training to a paediatric or even scrotal exploration at all might be 10 in their whole career. So you can understand why some general surgeons might be a little bit worried about taking on this work. So what I thought I'd do in the end of this video is just rumble through, describe what resources are out there at the moment, and see what we can do to keep on working with the different colleges to see if we can improve people's confidence and find out exactly where we do need to provide support to prevent children needing to be transferred for torsion care. So first of all, this paper here by the Birth Spouse Collective is a really good summary of how to see, assess and treat children and young people with torsion. I'll try and provide a link when they're next coming up. You can always find yourself a course. So this is one of the wet lab courses available in the UK. We'll be running some in the Yorkshire ODN, and I'll try and advertise them when they come through. And of course, there's always the old-fashioned thing of reading an article, and this article I found in healthymail.org is a really good rumble through and discussion of history examination and how to decision make in torsion and acute scrotum in young people. If you prefer a video, we've provided one in our local region. So here's a training video. It's a bit more in depth to what we're doing here. So it's a long read video that hopefully will be able to give you some ideas and confidence in how to assess and decision make in a young person's acute scrotum. And if you are interested in the topic, this long form webinar is really interesting, that was hosted by BAUS and ASGBI and BAPU, and might give you a bit more flavour and interest into the issues surrounding children and acute scrotum. And I just think the last thing to say is that one of the fundamental areas in which doctors can improve care in children is really understanding that children are not small adults and they are a different disease spectrum. And if you're used to assessing children and diagnosing epididymoorchitis, you're probably getting it wrong. The much more common thing is torsion or appendix testes, but we'll talk about that in one of the next torsion explainers for children, when we'll talk a bit about how useful ultrasound can be and when it can be used safely in children.